السلام عليكم، ازيكم؟ النهارده عندي ليكم فيديو مهم جدا، في مفاجأة وفي كلام جديد ومهم، وان شاء الله تستفيدوا منه اقصى استفادة. احنا اتكلمنا كذا مرة عن السليب ابنيا وعرفنا اضرارها وعرفنا ليه بتحصل. قلنا بسبب ارتخاء عضلة اللسان، عضلات الزور، والنوم الغلط، ورقبتنا اللي في وضع غلط على طول. واتكلمنا كتير عن الموضوع ده. في طرق كتيرة قوي تساعد مع علاج السليب ابنيا. اتكلمنا على شوية منهم، وان احنا لازم نعمل سليب ستادي. والنهارده جايبه لكم دكتور كيروبراكتور هيتكلم عن ازاي العلاج الكيروبراكتور ممكن يساعد شوية في علاج السليب ابنيا. دكتور راين، ومتنسوش لايك شير سبسكرايب. اتمنى ان انتوا تشيروا الفيديو ده علشان كل الناس تستفيد منه، وان شاء الله في فيديوهات تانية كتيرة جدا مهمة وهتساعدكم في حياة افضل. ده دكتور راين اللي انا كلمتكم عنه. هو دلوقتي هيقدم نفسه ويتكلم شويه عن ايه المشاكل اللي ممكن تحصل وازاي الكايروبراكتور ممكن يعالجها.
أنا Dr. Ryan. Muslim?
Muslim.
Oh, not yet. Sorry. Okay. Well, yeah. Apologize for the mispronunciations. Talk a little bit about chiropractic and some of the benefits towards enhancing the nervous system. Also, we'll talk a little bit about that effects on sleep apnea as well. But first, just kind of some of the basics of what chiropractor does and how some of the nervous system will work here. So we talked about areas in the neck being a really important area because a lot of nervous system nerve tissue coming out from that area. We see this chart, you can see the chart okay in there? Okay. So up at the top, why we are so concerned about that neck curve is because all of those nerves that are coming out from here, major ties to other areas, being major organs in our body, and one of the big ones is this brainstem up top here. Major input from the brain to the spinal cord that makes sure all those information come out over those nerves to those certain organs. Now, posture can be related, and that's one of the big things that we do as chiropractors is try to find those postural anomalies and correct them. So we see a postural anomaly and how that may restrict or affect us is that can put pressure there, and so especially in this part of our nervous system, the autonomic nervous system, so in charge of things that we don't necessarily think about all the time. So heart rate, how many times our heart beating into the day, how much air in our lungs, and digesting a dinner, release of hormones, all those things are going on in the background because of that input from the brainstem. So one of those areas we see that compression start to set on is we start to lose that curve in the neck, and so pressure on that area in the spine creates not a direct response, can start to interfere with some of that processes. And so as chiropractors, we're always looking at ways to rebuild that nervous system and maximize its effects. So one of the ways we do it is working on through that posture and getting that curve back to where it can optimize and be fully functional. Now, I know one of the main areas that have been talked about a lot is sleep apnea, and so how that can kind of play a role and a factor into our body and that neck curve and posture is because we don't think about it, but the major muscle that is innervated that will expand the lungs, decrease that lung volume is the diaphragm, and those nerve roots are coming from the third, fourth, and fifth nerve roots in the neck. And so one of the big things is sleep apnea during the night. You don't have that major airflow. There's something interfering with that. And so how we think about how's that affecting if that neck curve is off. There's compression. The phrenic nerve coming from there goes to the diaphragm and tells our diaphragm to work to enhance the opening and closing of the lungs. And so posture related issues can affect that as well. So basically, we're not treating sleep apnea, but what we're doing is we're releasing the pressure on some of those nerves where that nerve is traveling down there. And so maybe now that diaphragm can work a little bit more more function and can work without less stress. And so that's basically where a chiropractor can kind of come in and look at help treating some of the side effects, because what we don't want anyone to come across is we're going to be here treating this and that and this.
We're just helping and alleviating the problems with sleep apnea.
Absolutely.
And what are the main things that cause neck like malaligned posture in the neck? So I'm بسأله دلوقتي ايه الحاجات اللي ممكن تأثر على رقبتنا اصلا ان هي تبقى معوجة.
So one of the major issues that causes this is one, sleep position too. So when we're sleeping, oftentimes we're tossing and turning during the night, and we're trying to find the most comfortable position. One thing that also can play a major factor is what are we doing all day? We're on our phones, right? Technology is a big thing that I've seen, and younger and younger too, that we're developing these problems over the course of over the course of the years. It usually typically starts in their later 20s, 30s. Now we're seeing as early as school age, elementary school age, right?
Yeah. Can you show us on the spine how like the posture holding the phone all day like
this?
Yes,
absolutely, for sure. So typically, we want to see these nice 3 curves in the spine. There is that in the frame there. Good. So what the spine is protecting is the brain that sits up top, the brain stem that we see here, and so the spinal cord that runs in behind each of the bones here. And then from the front you can see these yellow pieces there. That's the nerve root. And so how posture can affect, let's say for example the nerves to the diaphragm. So the major motor and sensory nerves to the diaphragm are coming from C3, C4, and C5. So C1, C2, so C3, C4, and C5. So you can see how there is all this space for that nerve to come out. So what happens when we lose that curve in the neck, we start to see pull from the inside. Oh, there we go. Better. So we start to see the inside of that spinal cord starts to stretch, and they've shown that research will show us that they will stretch anywhere from 2.5 to 3 inches or 5 to 7 centimeters on the inside. So what happens, so now that posture being there, compression sets in, the spacing in between where the bones are starts to compress, and so those areas will start to have an effect on those nerves. One of the other things too is from the front, we also look at that there too, is so when we start to shift there, you can see just by looking at some of the spaces here, when we start to shift there, it's starting to narrow that area. Now it's not going to have, it's not only just going to affect the diaphragm, it's going to affect everything that nerve is going. Headaches and
nausea, fatigue.
Exactly. All the eyes, ears, nose, and throat. All these nerves are coming back up into that area of the spine there. And so, how that happens is just years of traumas to the neck, old injuries, and basically habits that we create. And so by that posture shifting up here, the constant force of gravity is causing this to really compress down. Now this model won't really let me show that, but over time that's what happens and allows those nerves here to really be compressed there. I kind of explained that a bit. So definitely posture, major effect in terms of that inside posture that I'm talking about. As everyone thinks, sit up nice and tall, that's where majority of the problems are. That's important, but unless that inside posture gets fixed, we see a lot of these things kind of carry forward. And so
and chiropractic itself, like it fixes this vertebrae or the spaces between them, or how do you work at that? So
the spaces, each time we do an adjustment, so hands-on manipulation, so it's very much the same thing. So when you hear that pop or that click, crack a knuckle, you hear that pop. So it's the same thing. Why is this so effective and why is it different than that? Well, because of the nervous system. the nerves. Every time we do an adjustment, it's like hitting the reset button.
Mm-hmm.
But it's just like any habit or bad habit at all. You know, how hard is it to kick some of those bad habits, right? And so that's why it takes time to allow the body to get used to some of those changes. And so what we do is we align the spine and then try to re-educate some of those areas to help hold that position a little bit better.
Mm-hmm.
And so that becomes our new normal, our new posture. It's more about just physically changing the position of the spine. We've got to encourage a new lifestyle basically too.
So what are the most important advice that you can give us to at least maintain what after your correction, or after the chiro or physiotherapy? How can we maintain a good posture and not go back to the disaster we're living in?
It's such a tough thing to do, because everything we're leading to is all digital, and just really making time out of the day, reminders on, like, I wear a watch to give me reminders. Okay, take a moment to just reset, take a break, because how often we get going, we're working, and then next thing you know, it's like 8-9 hours later, and then we haven't really moved or done anything. We've been so devoted to work, and a lot of patients and a lot of people are in sedentary work environments where they're sitting or standing for a long period of time. And probably one of the biggest takeaways I tell all of my patients is to just take time to allow those little micro breaks in the day. I do a big goal with myself, and all my kids do, screen time before bed too.
Yeah.
That's a big thing, right? Yeah, we're all exactly. And really making a conscious effort to try and minimize at least an hour before you go to bed, and that will allow that to allow to sleep through the night too. But that's probably the biggest takeaway is making the conscious effort to be aware of your position in space and your body position. Exercises, stretches, mobility, all that stuff is good, but if we're not practicing it all the time, it's tough to make those changes. So just those little changes by setting reminders in through the day will help a lot. So.
Okay, and what's the average chiropractic treatment? Like, how many sessions should we need at least, and the maximum in moderate cases?
Yeah, so in most cases, if you look on our BC Chiropractic Association, the average visit you'll see probably between 4 and 6 is symptomatically out of pain. Now, where I kind of pump the brakes a bit is simply getting out of symptoms isn't necessarily fixing the problem. And so that's when we kind of look, okay, it usually takes about 4 to 6 visits to get you out of pain, start to feel pretty good. But then here at our clinic, we really try to work on posture correction, and so that is a little bit more of a longer process. And so typically we see anywhere after that between 12 and 24 visits. So between 3 to 6 months is a pretty appropriate length of time, and that would be something somewhat frequent, every other week, to try and implement that new changes. And then most patients from there will just do some sort of like maintenance. It's like the analogy of like taking your car in for regular maintenance. It's not quite the same, but kind of the same idea, right? We put so many miles on it, and we develop these habits, and so every once in a while. But typically, to see a really significant change, 4 to 6 visits. So it doesn't take very long before we start noticing some of the benefits.
Okay, and if someone comes and they're already been treating their sleep apnea with the other specialists like ENT and all the other included specialists, how long would you need from them to aid in this help in relieving the sleep apnea?
And so in terms of like the actual condition itself, now it'd be tough to say, because that's something that we won't necessarily claim that we're not claiming
you're just
that.
helping with other specialists.
And so the adjustment itself, we'll start to see a lot of function in terms of the movement. Maybe we bring that pressure off of the diaphragm, get the ribs moving a little bit better, so it allows that lung to expand, and positioning of the neck there. We can see a pretty good change relatively quick, and some of the things that we can do to aid in that is just to make sleep a little, or positioning a little less painful, rather than you know, treating the condition itself.
Sure.
You know, how long would that take? You know, it may take a while for the nervous system to really recuperate. And there's a lot of, you know, a lot of inner workings with how things work. It's not as simple as just like setting the reset button.
Sure.
And so, you know, it will take a while, but like I said, very similar. You know, in terms of like breathing patterns, you'll see that happen pretty fast in terms of, you know, just with repetition and allowing that movement to happen in the first place.
Sure. So I came to Dr. Ryan because I had problems in my neck, in my back, in my arms, especially my right arm. I couldn't sleep. I was tossing and turning all night. I had severe headaches all day. So Dr. Ryan started by cracking everything and trying to align. And since day one, I've seen major things, especially during my sleep. I can sleep better, at least for like 4 or 5 continuous hours.
Yeah.
Because before I couldn't sleep even 30 minutes.
I would, it was very, very painful, right?
Yes.
And we've really only been working a very short time too.
I think like 6 sessions.
In about a month, 2 months, and so.
And I can work better with my arm now, and the tingling and all the stuff are way less than I experienced before. And I will continue working with him because the results I've seen have changed a lot in my life. I don't feel grumpy anymore. I used to wake up with like, oh my god, I'm going to explode.
Totally, it's you know, and it is those anecdotal cases that you know, when we look at, you know, a lot of the research behind what we do, there definitely is research, but it's those cases and you know, patient testimonies that are like, they speak louder to you know, some of the effects, and you know, I'm really happy that we've been able to make some really big strides. And I remember the first visit there, we were in a lot of pain, and you know, it took a while to even just get through a couple, but you know, we turned that corner, and I definitely, you know, just by, you know, looking at how we're moving and functioning, it's definitely you know, a big 180 turn. So
yeah, thank you so much, Dr. Ryan, and I appreciate your time.
Yes.
And Dr. Ryan is here at Westwood
Total Health.
At Tri-City Coquitlam, and hoping to see you soon.
All right, thank you again.
مع السلامة.
مع السلامة.
Okay, thank you.